Hello, Montrose County. This is our March 23rd COVID-19 update. Let's jump right into it. First off, we're going to talk about prevention, and I just want to point out that if you do not qualify for the current vaccine distribution phase, if you're not eligible, maybe you don't have the right age or the right health conditions, but you want the COVID vaccine, please go to montrosecountyjic.com/vaccination. That's montrosecountyjic.com/vaccination, or call 970-252-4545. That's 970-252-4545. And what that will do is it'll get you on a standby list. Tell them you want to be on a standby list. The standby list is there because we still have about a 10% no-show rate for people who register for the vaccine. And that, of course, causes problems for us because we have a limited amount of time to be able to use the medication once it is taken out of its vial. So we'll call you and we'll say, hey, we've got an opening. Can you make it down to the vaccine site? And if you can, great, you'll get your vaccine ahead of time. And then you'll be on the schedule for the booster dose if that vaccine requires a booster dose. So please go to montrosecountyjic.com and register for that COVID vaccine. Even if you don't meet criteria, you can still register on the standby list. And generally, people are getting in about 1 to 2 weeks. Currently, we are in phase 1B4. This is State of Colorado CDPHE's phasing plan as of now. It does change, so this is the latest iteration. And right now, we're in phase 1B4. So we're vaccinating people age 50 and older, people with a single high-risk condition. We used to require 2 back in 1B3, but now it's just 1 condition. And you can meet the criteria otherwise. Maybe you work in a critical industry, like maybe you're a correctional worker, a funeral services worker, someone in education or childcare. There's many industries that meet criteria for this. In addition to that, if you work for state or local government, you can be eligible for the vaccine. If you're interested in a full list of the eligible industries, go on to the CDPHE's website and you can find a more robust list there, or just call the county at 970-252-4545 and we'll help get you taken care of. At the end of the day, we want vaccines in arms. We are not going to scrutinize where you work, who you work for, what kind of job you do during your day, and we're certainly not going to ask you to verify your health conditions. So if you meet criteria, please register. We'll get you the vaccine as soon as we possibly can. So if you do meet criteria for phase 1 at all, 1A, 1B1, maybe you're late to the game and you just figured out you want the vaccine now, or all the way down to 1B4, go ahead and register for the vaccine clinic. We do have a vaccine clinic tomorrow. If you go to the website, montrosecountyjic.com/vaccine, and you click here to register as shown on the screen, then you can actually pick your vaccine administration date and time. If there are no more times, that means there are no more slots. So what you can do is sign up on their standby list. All right, so what are we going to do this week? We're going to do about 1,000 doses of vaccine this week. That is a combination of first and seconds. These are mainly going to be booster doses this week, but we still will have first doses going in arms this week. Excited about that. And it looks like the state is able to supply us some more Johnson & Johnson. We just don't know exactly how many yet, and there will be some Moderna going out this week. When we look to the nation, I'm so excited to see that 126.5 million doses have been administered. I think that's fantastic. If we look at the population with at least 1 dose, we're looking at almost 83 million people. That's 25% of the total population. And when we break that down, we say how many of those people are greater than or equal to 65 years of age. We can see that nearly 38 million people in that age group have had at least 1 dose, and that's 69% of the doses that have been administered. Excited to see that. And so when we look at fully vaccinated, we're looking at 45 million people fully vaccinated, and of those, the majority are in the population greater than or equal to 65 years of age. If we look to the bottom table, this is looking at Colorado state-specific data, and you can see over time, every week they add additional vaccine providers across the state. Fortunately, Montrose does have many vaccine providers, and when we look at their impact, they are making a significant impact on the vaccine delivery front. So when we look to Coloradans with 1 dose of vaccine, we're at nearly 1.4 million people. And we look at Coloradans that are fully immunized, we're at 871,858 as of March 23rd. So cumulative doses administered, 2.2 million. Great to see that for a state of only about 5 million people. So we are making progress. When we look statewide, this is the vaccine distribution levels for Pfizer, Moderna, and Janssen. And I'll correct what I said distribution. This is actually administration, so not distribution. These are actually administered doses. We see that there was some pent-up demand for Janssen early March. Those got administered, and then we've had a smaller uptake since then. There have been some decreased supply of the vaccine because everybody in the country wants these, of course. The Janssen, as you know, is the single-dose vaccine, so no booster required at this point. Of course, things may change in the future as we learn more about how long these last for and whether there are new variants that would need to have a modification. But good to see a big bump in March with the vaccine uptake, and then we continue to see good vaccine uptake except for on Sundays. Of course, most clinic sites are shut down at that point. If we look to our region as defined by the state is called the West region, and so that's Montrose, San Miguel, Ouray, Hinsdale, Gunnison, and Delta. Montrose is leading the way in total number of administered doses, 22 as of March 23rd, and we see that our surrounding counties are doing a great job as well, trying to get administered vaccines to their population. So with Delta at just over 12,000, Gunnison nearly 10,500. San Miguel at 4,700, Ouray at 2,900, and Hinsdale at 587. The majority of these vaccine recipients have been female, and the majority of them have been 60 years of age or older. And so there may be some reasons why there's a gender difference. Potentially we have people that meet the age criteria who, women tend to live longer, so there may be more females eligible than males. But we should see this start to balance out as the vaccine becomes more and more available to the population. When we look at Montrose County in terms of what the percent of doses distributed to us are as a percent of state population, we are slightly in the positive at 0.13. This is a high for us. When we have historically checked, we were, when they first started releasing this data, we were at 0.04, then went 0.09, now 0.13. It all depends on the day that you check the data. And early on, before they were reporting this, Montrose felt like we were in the negative, made that known to the state, and they helped get us some parity. They had some misunderstandings about some of the vaccine distributions to us at that time, but they fixed it, and we got vaccines in arms. Let's look at the status of COVID right now. So this is looking at statewide, and this is the overall county status. Now, the dial is changing. They expect to release a new dial in today or tomorrow, and that will be dial 3.0. And with that will be reduced restrictions based on your color. So even if we stay in blue, we would have less restrictions in place. Happy to see that. It's time, and the state of Colorado needs to relax some of their restrictions. We know that doing so may cause some increases in cases, but the original mandate was protect our healthcare system. We have done that. Our healthcare system is not in jeopardy, and it's not going to be in jeopardy for 2021 based on what we are seeing. And so we need to relax and let people get back to their lives so that we can find some joy again, go visit our loved ones in nursing homes who are still restricted in visitation, etc. I know you know what I'm talking about. And I also want to recognize that there's reason to be concerned. I'm not saying throw caution to the wind. I'm simply saying that restrictions on gathering and business activities can take second place to good common sense. Wear a mask when you can't distance, wash your hands. If you're sick, stay home and don't go out. It's really basic. And I think we can do that. And if you don't do that, then you risk getting sick or you risk transmitting your illness to somebody else. And if you're one of those people that is high risk and you're just not comfortable doing that, then you don't have to. You don't have to go to the restaurant. You don't have to go to the county fair. You don't have to go out. Remember that. If the population is moving that direction and you're not safe yet, that's okay. Maybe speak with your healthcare provider about when would it be appropriate for you and what are some of the best techniques you can do to get your protection to the highest level possible. And remember, vaccines work. They are the best weapon that we have to prevent this from harming you and prevent additional surges in the future and jeopardize to our healthcare system. So please look at the vaccines and see if that's right for you. I would highly encourage it unless your healthcare provider has advised you not to obtain a vaccine. So 1 week cumulative incidence rates by county. Montrose remains in the blue. We're looking good there from a 1 week cumulative incidence. That's in the 15 to 100 range per 100,000 population. You see that most of the surrounding counties of Montrose are looking good as well. Ouray's got a little bit of a higher 1 week cumulative incidence, and Gunnison is even better than Montrose and Delta, Mesa County, San Miguel, etc. with the green color. Like that, like seeing that in San Juan and Hinsdale as well. We're all moving in a better direction, however, although there have been some recent upticks, and we'll go over that in more detail. So when we look at 1 week average positivity, our area, our region is still in the blue with less than 5% of tests coming back positive for COVID-19 in the last 1 week. When we look at number of days with decrease in or stable hospital admissions, Montrose has remained in the blue, and it has been in the blue, or previously it was the green, which was the good color, for quite some time. We'll look at the hospital peak data, but that was a couple of months ago. So when we look at the state's dial, this is the three metrics they present: the 1 week cumulative incidence, your 1 week average positivity, and your declining or stable hospitalizations for the county. And so we see that we're still in the blue compared to last week. On the left, you're seeing March 15th. On the right, you're seeing March 23rd. So our cumulative incidence, though, in the week did increase slightly. So we went from 23 to 37. Remember, this is per 100,000 population. Montrose County has about 42,000 people in it. So this is really just a small number of people as a total percentage of our county that had contracted COVID in the last week, and far better than the numbers that we were seeing back in December when we were having numbers in a 1 week period of as high as 251. And so we are still looking good, although there is a little bit of a bump here from last week. Our percent positivity up just slightly from 1.3 now to 1.6, and maintaining stability in the hospital demand level. So overall, the dial is still blue. We're still good. We had a little bit of an uptick in 1 week cumulative incidence, and we'll look and see if that should be expected to continue. When we look at 14-day case count, now we were looking at 1 week just a minute ago. Now we're talking about 14-day case count per 100,000 population. That's shown in gray here. And so you see that we have this precipitous drop back in late January. It's like a cliff. We just went right off of it, and then have continued to trickle down since that time. And you can see, if you look to the very far right bottom part of the graph on that gray line, you see a little bit of an uptick in the last week. And with that, we still see significantly lower hospital levels than we previously saw back in December. So if you look back to that period, we had peaked at 14 hospitalizations for COVID positive patients and PUI status at that time, mainly positives, because we have rapid results now with in-house high sensitivity PCR testing. But the good news is, if you look to the very far right, the black line is your COVID positive or PUI status at the hospital, the census. That's 0. So we had a recent spike up to 3 again, but now we're back down to 0. So we're going to see that. We're a small community. We still will see fluctuations up and down, but for the most part, we are going to be running very low numbers. And so when we look to the model, this model only looks at hospitalizations. It doesn't look at cases, and it only looks at COVID positive. It doesn't look at PUIs. It also doesn't look at variants, which in Montrose County, no variant has been detected in Montrose County as of the recording of this presentation. However, I do expect we will have variants in the future, because we see that our surrounding counties have detected variants. Our neighbor just up to the north, Delta County, has variants. Mesa County has variants. And so it's not if we're going to see a variant in Montrose, it's when we're going to see a variant in Montrose. This also doesn't consider waning immunity that might happen from vaccine. We don't know how long that lasts. We know that natural infection is really good for about 90 days after you recover. After that, we do see increasing cases of COVID-19 again, although it's very small. And I'm hopeful that you're going to get a couple of years of immunity from the vaccine. I don't know that, though. I'm simply part of that is looking back at what happened with SARS-CoV-1 data and how long people remained immune back in 2003 when there was a SARS-CoV-1 outbreak. Remember, we're in SARS-CoV-2, aka COVID-19. And those people maintained immunity, at least by antibody detection, for at least 2-3 years. There was memory B cells detected out 8 to 10 years later. And so I suspect we're going to see longer-term immunity, but I don't know that. And this model does not account for the potential of waning immunity. It also doesn't account for the risk of having a concentrated high-risk exposure in a non-immune population of at-risk adults. And so that could happen. Now, fortunately, in Montrose, our highest risk population is our nursing home population, and they have been vaccinated. They were in the very first crew to be vaccinated under the federal Operation Warp Speed program. And so hopefully that does not happen in Montrose, but it's still possible that there may be a high-risk group out there that we don't know about. Maybe it's a church gathering, or maybe it's a group of people that just get together to have a card game. Those still can happen, although the risk of that happening is getting smaller and smaller as we continue to vaccinate more and more of the population. The other risk that this model has contained within it is a potential overestimation of the number of immune people in the model. So I don't know how many people recovered from COVID and who got the shot. And so the model just says, well, I don't know that, so I'm going to add them together. But what if 20% of those who got the shot had actually already had COVID and we didn't know it? Or maybe they didn't know it because they were asymptomatic. So that's still a possibility. So it may overestimate the percent of immune population. And the thing about the model is that if you take away the people from immunity, if you discount that from the model, you do see a summer increase in cases, and that can lead to an increase in hospital demand. With the vaccines, though, what we see is that we can return down to a public health effectiveness. You can see as I modeled here March 1st, that's simply a model number, 0.0. That with no public health effectiveness, we don't see an increase. We don't see a second surge. Now, without vaccines, though, we did. We had anticipated that if we had broken all public health effectiveness down to 0%, nobody was really doing anything, and they were back to pre-COVID levels of operations, then we would see a early summer spike in hospital demand, up to around 5, depending on how aggressive that relaxation was. You can see here in the model that on March 3rd, we did a transition to negative 130% public health effectiveness. Again, I never actually knew that you could have a negative, but I guess I should have thought about it. What that tells me is people, they were even more aggressive with their activities. So it wasn't just that they temporarily returned back to normal activities, but they actually had some pent-up demand. So maybe there was some increased gatherings, some large out of home operations, more people returning to work, more people gathering at restaurants or having picnics or birthday parties or whatever it may have been. But there appears to have been a relaxation, even more so than there would have been in pre-COVID levels, which is not totally unexpected if you think about it. People have probably been waiting to see loved ones and family and friends, and so there may have just been this move during that time to do that, and it increased cases, and it increased some hospital demand, but only to a slight level. You can see that back here in early February, mid-February, we peaked up to about 5. Okay, let's go on to the region. So this region is not the state's defined region. It's simply a region that we have been following regularly for many, many months. And so we look here, we look at Delta, Montrose, Mesa, Montezuma, etc. And I'll highlight the counties that have a red bar. The red bar means that they had a higher 14-day case count per 100,000 in this week's assessment than they did in last week's assessment. So you can see that Delta does not have a red bar, but they have the exact same number in 14-day case count per 100,000 population. So they were level. They didn't go down. They didn't go up. They had the same. Montrose County actually went down, fortunately. Montezuma went up just slightly. Mesa went down. Gunnison went down. Uray is stable, exact same number as they had last week. So we're seeing in just those few counties that most are going down, one's going up, and a couple of them are stable. Summit County and La Plata, though, are up from last week's 14-day case count report. Eagle County's down, San Miguel's down, Pitkin is up, and San Juan is at 0 down. That's good to see, and Garfield up just slightly. So overall, when you look at all the new cases here, this defined region is down, but just barely, just by a handful of cases from what was found last week on the 14-day case count report. When we look at the state's more narrowly defined region, this is looking at Delta, Gunnison, Montrose, San Miguel, Uray, and Hinsdale, we do see that they are showing that the daily change in the slope of the smoothing trend line, now that's a mouthful, but let me walk through it, is positive, or shown here in red. This is the bottom graph, the one that's green on the left and it goes to red. This is looking at the slope as it changes daily of the black line above. The black line is your smoothing trend line. So what are we looking up there? Well, the gray dots are 3-day average daily incidence, and the black line is trying to smooth out those numbers. So balancing them a little bit. So if your trend is positive on that smoothing trend line, the black line, then your bottom line has to be positive and has to be red because it's changing, it's increasing every day. And so that's not what we want to see. What that means is that if we were to hold that, then we would continue to see increasing cases of COVID-19 within this more narrowly defined region that includes Montrose County. So what we want to see is that comes back down. We start to see a reduction in 3-day average daily incidence, and we see reducing hospital demand. Now, we're already at 0 cases, so that's good. We want to maintain that. But if we continue the trajectory of more cases, we may end up with more hospitalizations. Now, fortunately, most people in Montrose County that have received the vaccine are in our highest risk categories, those who have health conditions that are in high risk settings or that are age appropriate. So I'm not saying that a slight increase in cases on this will definitely result in more hospital demand, but if it continued and there was a significant increase, it certainly could. So the hope here is that this starts to relax, it starts to come back down. Does this mean that we have to have drastic control measures put back into place? No, let's not forget where we've been. This is just a tiny little blip on a much larger graph, and we are significantly down on cases since our peak in late November, early December as a state. So the region followed that just slightly after that, and Montrose peaked in December on hospital demand. And this may be the expected future course as we see low-level prevalence constantly in the community. That's possible. And so you may have little periods here where you're up 0.086 on your daily change in the slope. That's possible. Remember, small communities as well, they're trying to balance these regions, but there is still a smaller population. So we can get significant changes with a small increase in cases because the relative change is larger than, say, it would be if it had happened in San Francisco, for example. Okay, let's look at variants just for a moment. Some people are wondering, hey, does Montrose County have any variants within it? The answer is no, but as stated previously, that's only a matter of time until we do. If you look to some of the counties around us, the B1427 or 429 variant, otherwise known as the California variant, has been detected in Delta, Uray, and Mesa County, and many other counties in Colorado, mainly in the metropolitan areas, but even in some of our rural counties. And so Montrose hasn't detected that yet, but it's only a matter of time, I suspect, because our neighbors have it. So we travel to those communities, and so we likely will be seeing that in the future. It's not to cause significant alarm, but it is potentially a more transmissible virus, so it's more easily passed from one person to the next. Now, the South African variant, this has a lot of people worried because it does tend to be more transmissible. There have been 11 cases found in Chaffee County. No other counties in Colorado have found that, though, and it sounds like this started from an inmate at Buena Vista Correctional Facility, and then it spread to employees of that facility from there. The UK variant, also more transmissible. There's been one case in Mesa County, and many other areas in the state have detected this as well. If we look to statewide case counts for COVID-19, this graph is as of March 23rd. We see a couple of blips here on the far right of the graph, but overall a significant reduction. If you look at that mountain peak of over 5,000 cases on a 7-day average back in late November, early December, and so we're significantly below that at less than 1,000 now. But seeing a couple of hiccups along the way here, not just a downward slope, but overall, though, still moving in the right direction. When we look at Colorado as if it's its own region, and we pull back that graph that I know you love by now, the daily change in the slope of the smoothing trend line, that is also showing positive, which is similar to what we saw in our West region. When we look at hospital demand, on the top left here, you see the acute care bed use. This is fairly stable when you just visually appreciate it, but it's up just 1% on a 7-day average from last week. That's pretty stable. I'm not alarmed by that. I don't think that means anything because you're going to see little variations here and there. If you look at the percent of ICU beds in use, this of course statewide, this shows a 0% change from last week on a 7-day average. Again, I don't think this means anything. I think this is where you're going to expect hospital demand to be at normally. You may ask, well, why was it low back in April? Well, remember we were in shutdown mode. People were afraid to go to the hospital. They weren't going to the hospital for anything. Some were dying at home instead of going to the hospital. So it took a little while for people to get back to pre-COVID level hospital demand. And so what I think we're seeing now is normal pre-COVID hospital demand. And you may say, well, we still have COVID hospitalizations, so when that goes away, we'll have a reduction in overall hospital demand statewide. That's possible, but I also think that as we relax some of our public health measures, you'll see the reemergence of some cases of things we haven't seen very much this year. Take influenza, for example. We have had just a tiny amount of influenza compared to years past, and that's probably because of all of the public health measures that you're doing to prevent the spread of COVID-19. So when that goes away, and maybe it's going away because there's no more COVID hospitalization fear, there will probably be more spread of viral illnesses in the future as our guard is let down, which I'm not saying is a bad thing. We, I think, all want to get to a day when we can go travel and see our friends and family and not wear a mask, but we can still do common sense things like if you're sick, stay home. If you have been exposed to somebody that's sick, you should stay home, wash your hands, and Just use good common sense. Nobody wants your illness, whether it's COVID or not. If you look sick, well, please stay home. So this is looking at CDC data for the nation. The lighter the color, the fewer cases have been detected during this period, reported as March 13th through March 19th. What we see in our area is we continue to see a reduction in cases, but you look to Utah, New Mexico, Arizona particularly, they also continue to see significant gains here, or in other words, reducing cases found on a per week basis. Now, what we do also see is that our metropolitan area, the Front Range of Colorado, does see more cases. They are a larger population, and so this is not cases per population, it's just how many cases. So we see that our more urban environments do tend to have more cases. If it was adjusted for population, the graph may look differently. And that is our March 23rd presentation. Thank you so much for visiting with us, and we'll be sure to get you more data next week, or if there's any breaking news, you'll hear about it. Thank you.